There's a real concern New York City will run out of vital medical supplies by April. So the mayor is putting President Trump's feet to the fire.
And if we expect those goods that are produced that we need for our hospitals to get there in time, there's only one organization that can guarantee that, and that is the United States military.
Mayor de Blasio telling us New York will need 53 million masks, 15,000 ventilators, and 25 million gowns, gloves, and coveralls within 2 to 3 weeks. Governor Cuomo predicting the state will require 30,000 ventilators to help the critically ill breathe.
Ventilators, that is the greatest need. We're notifying any health department in the state. If you have a ventilator and you are not using it at this time, or it is non-essential to your use, we want it.
The governor asking businesses to get creative, and Maker Depot in Totowa, New Jersey is testing out the printing of plastic 3D masks that are biodegradable.
What 3D printing is helping you do is design the whole structure for different face types. And then later on, we want to incorporate an N95 filter onto it.
President Trump has forged a good working relationship with Governor Cuomo this week, but a day after the commander-in-chief told reporters the federal government is not a shipping clerk, he received a call from New York Senator Chuck Schumer. Schumer's press office told Pix 11 the senator, quote, urged POTUS to immediately invoke the Defense Production Act to get ventilators and other important medical equipment to those who need it. POTUS told Schumer he would, and then POTUS yelled to someone in his office to do it now. Surgical masks are quickly becoming a precious commodity, and 2 medical professionals at North Central Bronx Hospital told us about an incident this week when a man with a hacking cough showed up on the 2nd floor with a dental emergency, not covering his face. A computer check showed that he'd been screened for COVID-19 in the emergency room 3 days before and had tested positive. Hi, Tamsin and Corey. I have to tell you that we have been getting a lot of communications on Facebook and Instagram from medical professionals, and we appreciate that. And they really have their finger on the pulse of what's happening in the hospitals. And one of them sent me an email in the last hour. It came from the Department of Health. Earlier this week, a deputy commissioner sent out this alert number 7, and it said, if you're sick, stay home as a healthcare worker. However, if you get mild COVID-19 illness, you only have to stay home 7 days from the onset of the illness. And something that did upset this professional that reached out to me and sent the email, it says that if there's a healthcare worker with a high-risk exposure to a confirmed or probable COVID-19 patient, you can keep working. There is no requirement for 14-day quarantine. So there is some upset about that because we know that many other people in other professions who have exposure, they are told to go into self-quarantine.